My name is Tanya Thompson, and today I will be discussing a health resource from the website Australian Curriculum Lessons called Healthy Eating and Lifestyle Choices, a health lesson plan for years 3-4. To access this lesson, you go to australiancurriculumlessons.com.au. From here, you go to More Areas, down to Health and Physical Education. From here, just scroll down and find our lesson towards the bottom of the page. This lesson plan is really comprehensive and includes curriculum applications, overall aim of the lesson and sequence, pedagogical strategies, extensions, homework assessment, and resources. In the Australian Curriculum HPE, this lesson applies to two substrands of the personal, social, and community health strand. The first substrand is being healthy, safe, and active in the making healthy and safe choices thread. The descriptor is identify and practice strategies to promote health, safety, and well-being. This descriptor is demonstrated in the Healthy Eating Survey activity, where students are required to formulate the results into tables and charts to analyse. The second substrand is contributing to health and active communities in the community and health promotion thread. The descriptor describes strategies to make the classroom and playground healthy, safe, and active spaces. Supportively, a peer stated the whole activity clearly aligns with the descriptors and aims with the poster. The development process includes identifying and promoting healthy food choices. CW 2019. Under the focus area of food and nutrition, I have identified 4 points that are applicable to this activity. The first two are food groups and nutritional requirements, which are addressed in the resource through an informative video at the beginning of the lesson.
I'm an orange. I contain plenty of vitamins C and D.
Vitamin B, vitamin C, what are they good for?
Strategies and healthy options are expressed through investigation and creation of healthy eating posters. The first of two propositions I used to critique this resource is, take a strength-based approach. Antonovsky, 1996, coined the term salutogenic. In health, this suggests promoting the benefits of good health rather than focusing on restorative motivations involving preventions and cures. This resource informs students of the purposes of healthy food with the Healthy Eating for Kids video and the diagnostic quiz. This is an opportunity for the teacher to explore the salutogenic theme further with the students, emphasising the positive focus of a strength-based approach. Akara 2010 suggests a strength-based approach encourages students to value their own strengths and resources to improve health and well-being for themselves and others, mindful that students are not individuals on their own, but individuals within a community so impacting individuals. HBA Queensland 2014. Agreeably, one peer commented, "This strength-based resource helps students identify, develop and articulate their understanding of healthy food by looking at what they know, like how much sugar is in a can of Coke, and what they can find out. Students are empowered by opportunities to share this information." LK 2019. A strength-based approach values a multifaceted concept of health. McQuaid, Quinestet and McDonald 2013. Whilst identifying factors that influence students' understanding and reasoning. Akara 2010. These ideas are clearly explored through the whole class activity health and nutrition survey, enabling the concept of perspective to intertwine with discussions of health. What influences change perspectives of healthy food? And why do students make certain food choices? The second proposition I used to critique this resource is include a critical inquiry approach. Students should be engaged in critical inquiries that incorporate research and analysis of health information, Akara 2010, enabling them to examine a variety of social issues across different contexts that determine perspectives, decisions and behaviours, Wright 2014. The critical inquiry approach understands social groups recognise health and health practices differently due to social and cultural diversities. This can be developed through group work on the Health and Nutrition Survey, where students have opportunities to share aspects of their home lives outside of school. Resultantly, pedagogies must be fluid and adjustable to ensure learning is meaningful and engaging for all students, Akara 2010, aligning with APST's Standard 1, Know Your Students and How They Learn, AITSL 2017. My peer also agrees. This resource uses a critical inquiry approach as students are required to analyse sources and real data in a context that is meaningful to them. Students can take what they've learnt and use it at home, eating healthy at home. JS 2019. Wright 2014 further explains critical inquiry is managing knowledge inquiringly, rather than just accepting facts. This can be clearly identified in this resource in the poster creation task, which requires web-based research to gather information on existing posters. A think, pair, share pedagogical strategy to communicate, evaluate and understand the information they have found. HBA 2015 also suggests the critical inquiry approach leads to those light bulb moments. Thus, inquiry pedagogy maximises understanding through a constructivist-based learning foundation. Simon et al. 2015. This resource has the solid foundations of an effective lesson plan. I have demonstrated the two propositions, strength-based and critical inquiry approaches, and where and how they feature in this resource. As well, there is a great incorporation of several cross-curriculum priorities. However, some minor adjustments could improve this inquiry activity. This lesson needs to be longer than the suggested 40 minutes, or developed over several lessons for students to genuinely benefit from the knowledge sourcing and analysis and development of contextual understanding. McQuaid, Quenester and McDonald, 2013. Also, students could research all concepts that contribute to good health, encouraging broader scope for critical inquiry, and enabling students to interpret information beyond the superficial, thus increasing understanding of perspective. Wright, 2014. Finally, students could invent their own ways to promote good health in schools, engaging the concept of empowerment with knowledge through a strength-based approach with a salutogenic focus. Antonovsky, 1996.